Hello and welcome everyone to one of the final sessions of the Diabetes and COVID-19 series. Thank you for your participation today and at any previous sessions you have attended. We appreciate your ideas and feedback thus far. I'm excited to bring you today's presentation, Utilizing Technology to Engage Patients During COVID-19. My name is Crystal Morse of Mountain Pacific Quality Health, and I will be helping to facilitate today's session. Now, let me introduce today's speakers. Stevie Tsai, a Senior Account Manager for Mountain Pacific, who brings her expertise in medication safety, medication reconciliation, and adverse drug event prevention. Stevie applies quality improvement efforts to reduce and prevent adverse drug events with reduced readmissions and improved health outcomes in targeted Medicare beneficiary groups. Stevie also forms community teams to encourage accurate medication reconciliation, patient education, and communication among stakeholders and providers in communities. Stevie works closely with pharmacy partners to extend knowledge and encourage participation in quality improvement activities. I also have the great pleasure to know and welcome Carrie Fairbrother of St. Peter's Health of Helena, Montana. To understand Carrie, you should know that from an early age, she loved helping people. She was selected for the Walter Reed Army Institute of Nursing and began a path that included better communication, disease prevention, and education for her clients and community. During her career, she has shared information on diabetes and dermatology as a presenter both internationally and nationally. She has worked as a certified diabetes care and education specialist since the mid-2000s. She's the past president of the Dermatology Nurses Association and works passionately for health advocacy. Being widowed in her 30s with 3 young children, after her young husband's death from melanoma, she decided that patient communication and education needed attention. She's excited to share her thoughts with you today and welcomes your questions and observations. Next slide, please. Before we get started, our objectives have remained unchanged throughout this series. We want you to be able to discuss COVID-19 current events, identify best practices for diabetes and management during COVID-19, implement quality improvement projects to improve diabetes diagnosis and management, and last, engage and empower our patients to achieve equity into healthcare. So now I'm going to hand it over to you, Stevie.
Thanks, Crystal. Thank you, everybody, for joining us on this Tuesday or Wednesday, depending on where you are. And I am going to dive into our COVID-19 regional updates. We are still seeing surges of COVID-19 across the nation, but there are some noticeable rises in some of our states. Alaska continues to really add active cases at an increased rate. We're still seeing exponential growth of COVID cases in Alaska, Montana, and Wyoming in particular. Guam is starting to see some of the fruits of their distancing labors come to realization. They are having their number of daily new cases begin to decrease. We are still seeing the total active caseload increase, but fewer hospitalizations. Thankfully, deaths have slowed down. They do still have a pretty high 7-day positive test rate. We like to keep an eye on that for 2 reasons. One, it lets us know sort of how COVID is trending in an area. And also it gives us an idea of whether or not we are providing sufficient testing, which we will cover again later in a state that is having more trouble with that. So there's Alaska and Guam. We also have Hawaii and Montana. Hawaii definitely had a surge of cases in August and September. They very quickly reenacted several of their social distancing measures and are getting that well under control. So kudos to Hawaii. Hospitalizations continue to remain stable. The death rate is mostly stable, and the number of active cases was unavailable because they've had some reporting changes in Hawaii So I imagine when we get back together again in 2 weeks, we'll have updates for you. All of the states and territories that we work with have really done a commendable job working hard to improve their delivery of data throughout the pandemic. Every week that I get on there, I see that there is new and better information. Things are visualized better, and Hawaii has been working on that. They transferred over to a new system on Sunday. So if you happen to be looking and things look different, that is why. Guam has also had some major changes in their reporting in the last 2 weeks. The methods we're using to collect that data are remaining the same. So the data is the same, we're just displaying more and in better ways that are more consumable for us. So you can see Hawaii maintains their 2.2% 7-day test average. That means they have good testing available to their population, and also they are containing the virus. As we move to Montana, you can see that it's a very different situation in Montana. Montana is 7th in the nation this week for new COVID cases per 100,000. I see Marcy has said in chat that Montana is struggling, and unfortunately that is true. Early on in the pandemic, there were some geographically isolated areas where we did not see huge cases of COVID-19. We are seeing those places catch up at this time and noticing some surges. Montana is definitely one of those places. They have added 33% to their active cases in the last 12 days since we last met. Their daily case rate is climbing. And we do see increased deaths associated with that. We're keeping a close eye on their hospital utilization and availability. Montana has had 11.58 deaths on average since our last webinar per day. And their hospital capacity is shifting. So they have about 37% hospital capacity available right now. And so those are things to definitely keep an eye on. Make sure that you're well connected with your state resources so that you can utilize available spaces as people start experiencing fatigue and a lack of resources. Northern Mariana Islands and American Samoa, who never makes our list, continue to be bright spots for us in our region. They really are doing a great job maintaining control of their quarantine process, where they're able to require people that come onto their islands to quarantine for 14 days, not come if they're sick, limited travel, and those strategies are definitely working to preserve the health of their populations. So nothing new in Northern Mariana Islands this week or in American Samoa. Wyoming is right up there with Montana. Montana is 7th in the nation for per capita new cases, and Wyoming is 4th this week. They definitely are experiencing a large surge. They have increased the number of active cases by 93% in the last 2 weeks. So they've effectively doubled the number of COVID cases that was experienced for the entire duration of the pandemic just in the last 2 weeks. The slope on their epi curve, so how fast they're adding those new cases, is pretty alarming. It's very vertical right now. So a lot of work to be done there to educate the population and support healthcare workers. Again, we're seeing changes in hospital capacity. We've definitely seen an increase in deaths. Unfortunately, Wyoming has experienced several severe outbreaks now in long-term care facilities where a large percentage of the infected patients do succumb to the illness. So lessons to be learned there, and hopefully the community can rally to protect each other a little more. Wyoming is the state where I really wanted to highlight that availability of testing. So you'll see on our map here that they have a 62.88% positive test rate for the last week. And that is largely because of a lack of available testing, either because it's patient perceived, where they don't want or aren't aware of the resources, or they're just not able to test as many people as they should. Right now, Wyoming is testing about 2 people for every 1,000 residents. And that is part of what is making it difficult to get their arms wrapped around this current outbreak. When you test that infrequently, it's very difficult to identify asymptomatic carriers, and that increases the rate of community spread. So that is likely a big component to some of the surges we are seeing in some of these rural states. As we move through, this is our per capita apples to apples comparison. I added on the national data for you just so you can get an idea of what the daily caseload looks like. You'll see that Montana is more than triple the national rate of daily cases for our snapshot for yesterday. Wyoming is 2.5 times higher, and Alaska is almost twice as high. We're also really trending pretty highly above the national test positive rate. So we likely need to increase testing in many of our areas. So there are lots of factors that go into that. There are a lot of shortages right now of personnel, of supplies, of testing abilities. So that's tricky. Hopefully we can start moving in the right direction there to get our arms around this. But those things will be very key as we move forward. And then last here, so I am a healthcare provider in Casper, Wyoming, and my husband works for our local healthcare system. And when we were working, we both worked 2 Saturdays ago, and our facilities had our first influenza positive in the hospital. So influenza season is definitely starting. We're going to need to keep a pulse on that as well as we move into the fall. So I brought up our map here just so we can start tracking it. You can see most of our areas, there's insufficient data or really minimal influenza activity right now, but there are starting to be pockets of high activity. And so we're going to need to continue to keep an eye on that. And hopefully we'll be able to share some tools and resources to help identify influenza versus COVID versus RSV versus other respiratory illness, because that triage is going to be really critical as we manage our resources as we move further into the fall and then the winter. So that is my update for you today, and then it is my privilege to pass it over to Carrie.
Good afternoon or good morning, depending on where you are. It's my privilege to be with you all today, and hearing all those statistics took my breath away because I'm in Montana, and I have family members that were diagnosed last week with we have enough community spread where we don't know where it came from also. But thank you so much. Next slide. Next slide. There you go. So why am I even sharing thoughts with you? We know that whether you're a family member supporting someone, a person who has diabetes, or whether you're working as a case manager or working as a, I'm going to say the old-fashioned word, CDE, Certified Diabetes Educator, because most of you know that word better than the current nomenclature. We all know that the most important way we've communicated with clients before, or you've communicated with your doctor, has been with face-to-face and with cues that we would get from each other. And I know that when I'm doing that with someone, I always try to focus on what do they feel is important that day. I love notebooks. I ask people to write things down and bring it with them so they don't forget what they were really concerned about. And then we try to get through as much as we can of what's on their agenda. I also focus on what the person tells me they're willing to do. And I try to hear what somebody's really saying to me. Next slide. I know that COVID is requiring us to reboot the way we work. And I heard today I was on a conference call for the cancer control group and for my dermatology part. And they mentioned that this season, this year, requires us to think in terms of delays and opportunities. And I thought, what a great way to think about this. Think about we know what's delaying us in times, like what I'll be talking about, but also to think about what opportunities that might bring. In melanoma, it actually brought them to find out that if they didn't do early surgery on some of the stage 4 melanomas and used some of the medications that are new, the biologicals, the patients actually had the biologicals before the surgery, they were noticing some great change to the positive of getting rid of the disease. So I'm hoping for the same thing in our work with clients with anything that we consider a disease that we chronically have to care for ourselves. So lots of times now we get people not able to come in or unwilling to come in. When you hear those statistics in my state, in Wyoming, I would suggest that people that already have something may not want to come anywhere near a hospital or a clinic. All of my classes have been canceled that were group classes, and I love those because the most reticent person would hear another person give a query, and then they would say, wait, that sounds like me. And they would participate either with their eyes or with their mouth. It's harder for most of us to follow every client because you're having to try to get on each other's schedules, try to get the phone calls to go through, more technical difficulties. So how do we engage better, between the calls? How do we do this? Next slide. So we're trying to communicate. And when I think about communications, I always like to use stories in my work, perhaps more than these slides that you have access to. And I'll say that most of us have assumptions about our patients with a chronic disease or about how the chronic disease works. But in my own situation, I can tell you people hear what they hear, not what you think they've heard. So my own mom must have told my dad that when she was diagnosed with a very early diabetes, that she had a chance of becoming an amputee. That means that's what she heard. I hate to say this, but she went to classes that I was teaching. I mean, I wasn't necessarily her teacher, but this series of classes was in my institution. So my dad came up with a tremulous voice to me and he said, "Do you know when your mom might lose a leg?" And I just looked at him and I said, "Never." So from then on, I thought to myself, this is maybe the way other patients, they get that diagnosis. They might remember a movie or a TV show or a book they read about diabetes. And that is between you and talking with them. So I have a mug that I use that I bought at a Taking Control of Your Diabetes conference. It says, and I bring this out on the table for my first connection with a client or first connection with a group. And it says, I'm trying to figure out how to do this on the phone, probably take a picture. Attention, well-managed diabetes is the leading cause of, that's on one side of the mug. You turn the mug over and it says, nothing. Surprised? Those scary statistics don't apply to well-managed diabetes. And that's from the behavioraldiabetes.org is where you can get that. It's Taking Control of Your Diabetes is where I bought it. But think about, as you're sitting here, what something you might be worried about. If that's what's on your mind, you might not have any better, you might not ever hear another thing that the person's saying, and how much more important that is when we're really possibly seeing each other through technology or just hearing voices. So I also want to make sure that when I'm talking to someone, whether it's before, if it would have been in a clinic, or I'm getting a referral, does the person have any way to communicate? Do they have that phone or computer? Do they know we're going to call them? So sometimes people say, I can't get through to somebody, but do they know that they're going to get a call from this number? Because many of us don't want to pick up the phone to every number, especially this past political season, but for lots of reasons, they're not picking up just for a phone number they don't recognize. If they are, let's say, less technically capable, the way I feel most of the time, is there somebody nearby that can help them? And have they used any software, even if it's something for dietary help, so that they've been accustomed to using any software before, which obviously makes they've had a phone. Then most important of all to me is, have we mailed them any materials that they can understand? And that more than that, is the font big enough for their eyes? Is the language in the right comprehension for their health abilities? So they have something to refer to during your call. Next slide. So we also in research have found out that since many of you are following up with a client because perhaps they're not attaining their best for their own self-care, that the leading cause that people are not doing well is because they're not using their treatment. So what does that mean? We find out that 80% of the time, people aren't refilling their RX, and some have not even filled the first RX. And this goes across chronic disease, whether it's atopic dermatitis, blood pressure pills, or diabetes, or other cardiovascular or other chronic diseases, asthma, et cetera. They're not taking their medication, even if they have it. Are they forgetting? What else is going on? Is it the wrong dose? That clearly happens if somebody starts on a dose of medication that's usually titrated. If it's never titrated, that's going to be a problem. And then what about how they feel about it? Does this taking medication mean I'm sick? So one class I sent that out. I asked the class, so I had a slide and I showed person A with an A1C of 8.5 and taking no medications, and person B with an A1C of 6.7, taking insulin and taking a couple of other oral medications for their diabetes and blood pressure medications also. And I said, which person is healthier? And you would not believe how many people said the person with a higher A1C because they were not taking any medications. So it's really important that we think about, is there value to this person? Do they see a value for their medications? And I especially think it's important to know that patients will stop taking it because they take one day and they say, my blood sugar is the same. I don't see any difference. Why would I take that? And certainly with most of the diabetes medications, we're going to be titrating them. So important for them to know. Next slide. So next slide, I'm sorry. So this is a statistic too that I did write down so that you could have all the references for it, but 73% increased risk of all-cause mortality due to poor adherence to oral hypoglycemics. That is so scary. And that's oral hypoglycemics. I mean, that's really scary. So my story about that is I was lucky enough to be invited to Belize last year when everybody was still traveling. And I was not supposed to be working, but it turns out that the woman who was taking care of somebody's mom ended up being in a local hospital because her blood sugars were 500 and something. And so my daughter's an emergency room doctor, and she said, have her talk to my mom when she gets out of the hospital. So we had this visit, and why do you think her blood sugars were that high? She was not taking any of her medications that were given to her. Why? Because when you take medications, you end up being blind and losing a limb, according to her regional experts and her family. The last time when Aunt Mary started taking medications, in this case it was insulin, that's when she needed to have dialysis. So of course, we all know, listening to this call, it was because it was so late. But I spent a few hours, several nights, and by the end of the time, her blood sugars were well down because she would take it. We talked about why, what amount, and I gave her clues before she went back to the healthcare provider each time. And very satisfyingly, she was in no higher than early 200s after meals, and she was around 140 fasting, which was quite a bit of difference in that short time. But what did I have to emphasize? You're not there yet. You need to continue to work with your physician or healthcare provider, I don't remember who it was at this point, until you are in a better spot, and making sure she understood what that better spot meant. But first I had to hear her, because it wouldn't have mattered what I said. She wouldn't have been taking the medicines if she didn't understand that they weren't going to cause her trouble. Next slide. So what about people that have impaired glucose tolerance or impaired fasting glucose? We're not talking about medications in many times for those people. So we still need to remind ourselves and I say remind ourselves because we need to be doing these things, that healthy lifestyle interventions is important. They may delay onset of type 2 diabetes. They are useful for the whole family. And more importantly, there are things that, if you're just looking for general health and well-being. So again, I wrote those down. And the one most of you are real used to hearing: sleeping, eating correctly, meaning less processed foods, less high fat foods, less, etc. But eating a healthy plate method is what I usually prescribe for something quick. No tobacco product use, moderate activity that's continuous, not just weekend warriors. And then that social engagement part, which again can be difficult right now. So talking to people about Zoom churching maybe, or doing some Zoom with their family members if they have that. And let's say they say we don't even have telephones and all those things, then getting out for a walk, wearing their mask with friends so that and staying apart so that they're at least out and about and not being isolated. Next slide. So of course our aim is to make people as healthy as possible and give them the tools they need to do that. And I love the quote from Sir William Osler, who is a Canadian: to live a long and healthy life, develop a chronic disease and take care of it. And I can't tell you how many times I've used that quote with patients of all different chronic diseases. Next slide. So how can we do this now? We've got over 300,000 healthcare apps available. We have healthcare apps that give people immediate feedback. We have reminder messages. We have things that can link the provider or a family member with the client so that we can give them feedback more successfully earlier. We can try to support whatever the client's goals are better. And now with some of these apps, we can also get the information before we see the client so that we're better prepared to give advice or to respond to what the patient's seeing as their needs. Next slide. So these apps are ones that when I talk to people about what are their favorite apps, they give me these apps. And they are people sometimes with diabetes or people with impaired fasting glucose or impaired tolerance. But basically, some of these apps are more specific to someone who's checking their blood sugars more often. Some of them are just more dietary apps. But for Tidepool works for the continuous glucose monitor and pumps. Blue Star works successfully with patients getting themselves connected to their own information better and to give that information to other people. And then the medical ID app, I was told all of us, whether we have diabetes or a chronic disease or not, should have in their phones. And I wrote Android, so I'm thinking it's probably newer and maybe just available. I hope you can get the slides because I gave them to them. Yep. Anyway, I'm hoping that people do it because they said that medical ID for anybody who has a phone will help in any emergency for people that are finding you. So I thought that was a great one when, say, you couldn't speak and tell people your allergies, et cetera. So next slide. Now, the people that are using continuous glucose monitors and insulin pump users, these are terrific. And they are typically the top group are with their own forms. So whatever, if it's a Dexcom or Medtronic or Tandem T, they have their own information that they pass on, and they're set up to make it easier and easier. So if somebody knew about a pump 5 years ago, it would be completely different right now. And because I'm teaching these, I make myself use them because I want to be more compassionate for use. So I have a story to tell you because I did not have one of these apps in any form. I was just learning how to use a pump. And so I put on a pump and I started thinking that I was really doing just so. It was an Omnipod and I thought, I'm just so hot. I know what I'm doing. And I am a diabetes educator after all, so I surely should know I've helped other people. So I put this pump on. I was supposed to be wearing it for 3 days as if I needed this insulin, and it was saline, obviously, that I was getting. And I will tell you all, it didn't hurt. It didn't feel a thing. It hurt only pulling it off because I have a skin condition, so my skin didn't like the stickum, but it didn't hurt. Nothing was going on bad, except that you had to remember to tell it how many carbs you're eating and give yourself boluses and make sure your basal rate was fine and all that. And I was doing great. And it was a very busy conference. And it was in Texas, in Houston. It was very hot. And so I can tell you it worked even doing activities with the heat. It was great. I felt like I'm so smart. And then I was really busy at the exhibit hall, had too much stuff, had to rush back to my You can imagine I'm one of those people who grabs everything from those exhibit halls. Had to run back to my room and put all the stuff there, raced back to where we were having a dinner meeting with a really great speaker. So I wanted to get there early so I could see, etc. Realized that I didn't have the actual phone that you would tell you how much insulin to give yourself after you said how many carbs you had. So I didn't actually have that piece. And I felt, because you're supposed to pretend you really have diabetes. So I knew I was still getting my basal rate, but I couldn't, and they had fabulous rolls and hors d'oeuvres and high carb desserts. So what was I going to do? I had to eat salad and the protein and the vegetables that were non-carb vegetables. And then when I got back to my room, I had to pretend to test my blood sugar and give myself the bolus that I would need. Talk about feeling, here I am, the person who's studying it, knowing it. So I have much more empathy for people using, whether it's a CGM, which of course is more getting the information, but certainly when they're using a pump, or even forgetting to take their insulin with them if they needed to give themselves the injection. So I think whenever we think about all these easy, wonderful, up-to-date apps and pumps and CGMs, you still have to use them. And so I think that made me much better. But these, again, the list is there for you. We happen to use One Touch Reveal with our patients with gestational diabetes a lot more. And what I will say is, even so, these often link without the patient having to put something in, type anything into their phone. But even if they did, the information is all in one place. It's not on a scratched piece of paper that is sitting somewhere that they forget. And so they can honestly look down at their results, and they're much more prone to be able to experience the aha moment of, oh yeah, it was those 2 donuts I ate and I should have had a half a donut that made my blood sugar this way. Next slide. So the nutritional app, some of you may have even used MyFitnessPal. Fujicate is one that's a newer one that people really love. Again, same idea. Lots of times, the more we enter the foods we eat and enter our activity levels, etc., the better we are at seeing what cause and effect is going on so that we can act upon it. Calorie King is an older one. A lot of my older patients used that. They used it in the book form, and they still have the book form, and that's great. The process of writing down or entering in what you're actually doing can really make you see what you're doing. And that is what many patients, it holds you accountable, will say to me. And then Noom, you've heard about on TV. I went on to their link to see it, and it sounded great until it got to the cost. And it was quite costly. And my clients, quite frankly, don't have that money. And certainly now with the situation we're in. So I don't ever advocate for something that's going to be too costly. Some of the other programs on the prior pages had both a free part and then a more extensive paid for part. And when I read reviews or talked to people, sure, it helped to have some of the more extensive parts, but they could do just fine with the free. And that's what I was looking for. Next slide, please. So great, what do you do with this kind of information? Well, I'm going to tell you briefly about one client who's using it and was one of my stars, because you always like to talk about your stars. This man was kind of in a plateau position. He wasn't by far way out of line. He was very obese. He was over 340, something like that, pounds. Oh, good. I'm so glad you're doing that. She's wearing the freestyle. That's great. But this gentleman had type 2 diabetes. He was using only oral medications. His blood sugars were up a bit. He wasn't terrible, but he wasn't doing well enough, and he kind of plateaued with everything. He had lost just a little bit of weight, but they were concerned he was losing weight because his blood sugars had gotten up a little bit. He wasn't active enough. He was obviously eating more food than he could use up because his weight was real high, but he just wanted to do better. So I brought up to him, we had just been engaged with Blue Star in my state with our state diabetes coordinating team as a pilot. And so I brought this idea up to him. And so this is an app where he has to enter his medications and his blood pressure. And if he had a blood pressure monitor, he could have it connect with it. And his meter, we got him a meter that would connect, so it automatically would input his blood sugars when he took them, if he scanned it next to it. He had to put in his activity level, how much water he drank, how much sleep, etc. He had to be engaged, but he did all this, and he's lost 55 pounds since we started last year. He said, this was his quote, it keeps me on point. When I was camping and doing stuff, I didn't really use it much, and my old habits were creeping back. I was choosing foods. These are his words. I would never say wrong foods, but he said wrong foods. And he said, the real thing is it keeps me accountable. So he's doing terrific. He is a patient that I use these skills. I really tried to think to myself the why behind his behaviors. I definitely rewarded. At the beginning, he wasn't bringing any blood glucoses in, so I couldn't really tell. I always tell people it's like asking me to advise you on an investment, and I say, buy widgets. And you say, oh, sure, I'll go buy widgets. But I would say, I would hope you would say, give me some data. Why do you want me to buy those widgets? And I usually use a numerical number so they understand that it's a lot of money to spill around. And then I say, and you're worth so much more than any amount of money. I usually rephrase the question because you need to know. Many patients don't even know what they're taking, or if you need to know if they're even including that medication that's on their list. So I don't ask them, are you taking your medication? Because even my personality, and I'm a pleaser, if you said, are you taking your medication? I'd say, yeah, quickly. But instead I say, what's the hardest thing about taking it? And I give them permission. How many times have you missed it? Basically, how many times have you not taken it this week? Next slide. So the blue star that I was just talking about, again, I'm not advertising it. I'm suggesting that this is going to be the wave of the future, that we're going to be doing more health for populations, and we're going to have patients receive some guidance that's not just us on the telephone, but more immediate guidance. And so this is what happens. They get this personalized, and they get this right on. It comes right to them when they go into the app. It gives you have a passcode, etc. And it will even give you kind of a little reminder. Have you been doing this activity? Or looks like you're not sleeping enough. Or it might say, maybe you want to take this little video education about choosing more green, or maybe you want some recipes. They have millions of recipes on there, and they actually are quite good. So it's all within this one app. Next slide, please. So this is Welldoc's Blue Star. Again, I don't want you to think I'm advertising it, but I think this was the most comprehensive one I could find. It would mean that Mountain Pacific Quality Health would engage and discuss with Welldoc about coming on to this product, because it's not something that's just available over the internet. But you can read about it and you can see vignettes. If you go on to Welldoc Blue Star, you can read and see what they're talking about. It's just so brand new. Next slide, please. So again, this is stuff because we've talked about diabetes on these conference calls, but giving more information to a population. Next slide. And the digital health, how the digital health works. And I know you're going to get these slides, so I want to have some time that we can all visit. So I'm going to move through a little bit more quickly. But you can see the real-time feedback is what I was talking about. And then the client tells that it's definitely up to you don't get the information from the client unless the client wants you to. But the client, you get your information about him, but it doesn't just go out to any other physician. They have to say, connect to these people. So that gives your whole team the information before they're taking care. So whether you'd be the pharmacist on the team, or the social worker on the team, or the prescribing physician or endocrinologist, everybody could know. So basically, you can also input messages back to the patient without even having to call them up. So you could say, now looking at this, can you test now after dinner for a week or something so that we can see better what's happening with that time. Next slide. This is interesting because it kind of talks to you about the platforms that are happening and where they're showing the interventions. And I love the pattern coaching, the things that were really good. I liked seeing the insights and the curriculums that they sent out. And what I did was I engaged myself so I could see, and it keeps asking me for my weight. They don't know what to do to talk to older ladies, but they keep asking me for my weight. So I keep saying I'm not doing it anymore. But it asks me about every 3 days for me to input a weight. So they do ask if the patient doesn't put in blood sugars or doesn't put in some that they're taking their medications, or if they don't show, or they'll give it a little thing like they'll say, for this prize, will you have 3 meals that you show us your complete meals or snacks? So it's very interactive, kind of gamish at times, but it seems to be what people like. Next slide. And there's just showing you what in this is past tense, people that were using it and what parts of the app they use the most. Next slide. Again, this is where I think we're all going. And I'm a one-to-one person, but I do see the advantages of us being able to do programs with diabetes education that works for communities better, and that we can see where we can give people individualized care, but within a group philosophy. Next slide, please. And they all have free materials. This one is November, so it's Diabetes Month. This was just one of the free pieces that they had on the Welldoc document. But if you go to TC, that's Taking Control of Your Diabetes, one of my favorite ones. Welldoc, of course, the American Diabetes Association, Association of Diabetes Care and Education Specialists. That's the one the CDE used to be called. That works. They all have lots of free materials. Nobody should have to be buying education materials. The other place that I miss saying is your pharmaceuticals. Nova and Lilly, and I would just say about all of them have fantastic materials that make it easier, and their pharmacy reps will try to get them to you. So you shouldn't even have to be doing too much printing of your own. And in these times, we need the monies to be spent on patients' medications, not on just education materials. So again, go for it, ask for that help. Next slide, please. I'm looking at my time. Good, I've got some time for discussion is what I'm hoping. Good, Marcy, great. Thank you, Marcy. And I want to thank you all for all the work you're doing. I'm, again, appreciative that you're listening to my thoughts about these things. Think of our opportunities right now, and obviously we have some delays because of COVID, but think of the opportunities it may be bringing you. I think it's a more upbeat method. And I have some questions for you. Next slide. So I would like to and Marcy's on, so she's used Blue Star. But what apps are you using now, and how's it going? And what's been the most difficult part of communicating with patients? And you can choose any of these questions, but I'm hoping you'll engage with each other. And what's been your most frustrating barrier, not just now during COVID, but in general? And however you open that up, could you do that, Stevie?
Yeah, so if you would like to talk directly with Carrie, you can unmute yourself using the toolbar for Zoom, or you're welcome to chat in the chat box. So we will give you a minute to have somebody pipe up and talk with Carrie.
And I'm actually hoping you're talking with each other, because I think we learn best that way. Okay, I see there's a Nutrition X. Maybe she can tell us more about that, or he can. What have you liked about that app?
Tammy, are you able to unmute yourself?
Can you hear me?
Yes.
Okay. So the reason I use this one is because it's kind of like MyFitnessPal with the food part, but the
Mhm.
only people who can approve a new food in it is a dietitian. In the MyFitnessPal, anybody can put any food in it.
I see. Okay,
And it's free.
great.
And if
Good.
it's not in there, then you can go ahead and put it in there and it'll say send for approval, and then they'll add it to their list if they agree. It
So-
also has the barcode reader.
That's great. And I think that the thing that I failed to say that my client had been using, I think it was MyFitnessPal, the one who has been using the Blue Star so successfully. And he said, actually, he felt that the Blue Star app was even better. So I don't know if he would have thought yours. I don't honestly care which one they use as long as it helps them.
That's my opinion too, but I do like that one better than MyFitness because then they can definitely know what they're counting for carbs is exactly what it is.
Right. Good. Has anything been more difficult for you, Tammy, now that you're on the line during the pandemic, or something that you found?
I use a lot of telehealth right now. So
Good.
I have, that's kind of been hard in getting people to, because getting people to come in, they're kind of scared about coming into a clinic setting or hospital setting. So I think that's the only difficulty I have.
And
And
somebody
insurance
told me,
companies,
yeah. And somebody told me it was difficult to get people to pick up their phones. Has anybody been finding that as a trouble?
I think I tried, but they don't like that part. They like to see my face and I like to see theirs.
Good.
And then Mary has typed in chat that the State of Alaska Diabetes Program has partnered with Ameda Health to offer a diabetes prevention program. And it looks like they have an app that can track food, look up recipes, and connect with their health coach and their peers. So,
Great.
Mary, are you able to unmute and tell us a little bit about how that's going?
Yeah, can you hear me now? Yes.
We
Yeah.
can.
Okay, so it's not quite what you guys are doing. I mean, I'm not a diabetes educator and don't work directly with patients, but at the state level, we're trying to get diabetes prevention programs more accessible, which is difficult, especially here in Alaska, and I know other states can relate, just because it's hard to make in-person programs available in small communities when you might not have somebody that can teach these programs. So we partnered with Ameda Health to make a CDC recognized diabetes prevention program more accessible to Alaskans. And it launched in January. And I think so far, I think we've had almost 200 people enroll so far, and they've lost over 1,000 pounds. And I hear really great feedback. I don't often get feedback because participants don't really know I'm the behind the scenes person, so don't send me their feedback. But sometimes I do catch feedback from people, and it sounds like it's going really well, and people really enjoy it. So
Great. And that it's working now is what I'm pleased with.
right.
Marcy, do you want to tell anything about our program in Montana?
Hey, this is Marcy Butcher with the Montana Diabetes Program, if that's who you're talking to, Carrie.
Yes, I am. Yep.
Awesome. Well, thank you for your great presentation. It's so awesome to hear about communicating with people in this time of COVID, which means we have to get creative, right? And so I also appreciated hearing from Mary about Alaska's project with the DPP. I'll let you know that Montana's in the process of doing I think they've done a request for proposal to do an online product such as Omada or similar to Omada for the diabetes prevention program for Montana as well. So I think states are trying to figure this out. We're trying to reach people in many different ways. The other thing that I was going to talk about just a little bit is our the Montana and Diabetes Digital Health Learning Network, which is the diabetes program, is funding a project, pilot project that is using the Blue Star app for patients with diabetes, but using it through the diabetes educators. So the diabetes educators have to be the one to offer it to their patients. And then we're able to get data on the usage of that product, see where they're using the different pieces of the app. A lot of what we're finding out, of course, is that they're using a lot of the nutrition pieces of the app. It also has an embedded education components, and based on the DCES 7 self-care behaviors. And so we're learning a lot about our patients that are using it. We're delighted that men are actually using it quite a bit, which is a target of our work because men are hard to reach. We know that many of people who attend diabetes education are women, and so we're trying to find ways to reach different populations of people. So we're going to be learning a lot along the way in this project. So if you're interested or need more information, let me know.
And then Mary Snyder has a question for you in the chat.
Sorry,
Yeah, you're okay. She says, this Blue Star app sounds really wonderful. Are patients referred to this by their provider almost as a prescription? What's the process for getting someone on?
The way we're handling it in Montana is there's the certified diabetes educator. Because we're doing this as this pilot program, we mention this as much as we can to our clients that we think would be helping them, support them. And then if they're interested, we set them up, they have to have a code, etc. But it's because we're doing this pilot program. When I asked, so I called because I didn't want to say anything. They said basically the program has to be accepted. And my understanding would be like Mountain Pacific Quality Health would be part of it. And then your managers, potentially diabetes educators, could use it from that. But it has to be set up. It's not something that an individual can just go on and set up on their own.
Yeah, and this is Marcy again. I was just going to say, and I think diabetes educators or diabetes care and education specialists are offering it individually, but there's also opportunities to maybe pull a list of all your patients with, for example, diabetes with an A1C over 8, and whatever other parameters you want to do, but then send them, if they've got email, a mass email list, and doing that invitation, more of a population health strategy to introduce the product. And then when they have signed up and they put in their diabetes educator name in some of the fields that are entered, then the diabetes educator will know that that person has signed on to that product. And so there's some different ways of managing or trying to work within the product or get patients to use it.
Right. And in the pilot program, there has not been a charge.
Right.
Because that was a question. And when I did call Julie, she said that sounded to me from her answer that it would be like the Mountain Pacific Quality Health people, the hierarchy would call, and that would be set up before individuals could go and do what you're saying.
Yeah, I think we'd have to have that conversation, but it'd be wonderful.
So, but we do have if anybody's interested, I will tell you, it's very easy to just go on and Google Welldoc Blue Star, and all the information, including those videos, are there. So I just didn't want this to be deemed like I was trying to enter you in that situation, because it's not as available yet. But I did want you to know that it will be not just Blue Star, but I'm sure there'll be other ones, and how amazing it will be for clients to have this, and for us, because you can't really advise without the data. I always think about that when people ask me, they come in and they really think you're going to be able to do something for them, and you don't know even the medications they're taking or how much of it is. that they're taking, or if they're what their blood sugars are, that you know nothing. And so having these tools available before you saw somebody could make that time much shorter and much more valuable. Anybody have any others? I see the valuation coming up. It looks like it's almost time. I'm sorry, you guys.
Oh, Carrie, this has been wonderful. If anybody does have any last minute questions, now is the time. And we appreciate the overview of many different options of things we can bring to patients. Marcy says it's the apps, regardless of what they are, that helps people to self-manage. And that's so true. You know, we've talked about in previous sessions that ability to self-manage is really what helps a patient be successful. All of these conversations around patient-led goals and getting patients what they need when they come to see their provider, I think is a really great space for healthcare to be in. And so I appreciate you sharing that with us today, Carrie.
Thank you. Thank you all.
So as we get ready to leave each other today, we're going to talk about our leaving in action again. Again, we want you to reflect, share something you learned today with your care team. And then we're going to ask you to evaluate your workflow. What does your organization do to integrate technology to help engage patients? Are you able to use any of these apps? And then our last thing is we'd like you to identify one new patient engagement tool or idea that you could implement in your organization. With that, here's our contact information. If you have any questions or concerns, we can absolutely help get you in touch with Carrie as well if you have questions specifically for her. And I will move us to our thank you slide. We do have a couple minutes left where we can stay on the line. If anybody has thought of anything as we get ready to leave, if there's anything you want to share.
Stevie, this is Crystal, and I would just like to add that the next and the last session is December 1st at 4 o'clock.
Wonderful. Well, thank you everybody for joining us, and we will see you again on December 4th.
Thank you.